Really excited to be able to share with everyone our experience at UCSF using AIR Recon DL. As mentioned, I'm Javier Villanueva-Meyer. I'm a neuroradiologist at UCSF. And today, I'll be sharing some of our experience with this new technique. In particular, I'll be focusing on how we can improve image quality in the spine, improve image quality in small structures in neuroimaging, including the skull base and head and neck. And I'll be sharing with you ways in which we can use this tool to speed up imaging while maintaining good image quality. So let's dive right into improving image quality in the spine. And I'll start by setting the scene with a sort of a common clinical scenario that we often encounter in neuroradiology. This is a patient who is, say, potentially transferred to your institution, and there's a concern for compressive myelopathy. And these are the outside hospital images that are provided to you. And you're reviewing the case in your multidisciplinary group meeting, a meeting like this, which unfortunately wouldn't happen anytime soon for most of us. But the consensus is that, we can't really see what we're seeing, what we want to see rather. Let's repeat the scan. And the reality is that repeat scan is not much better for a variety of different reasons. So, this is, as far as I'm concerned, a fantastic application for this technology, and I'll show you why. So here are two representative images, sagittal and axial T2 weighted images through the cervical spine that are, as you can see, fairly good quality, definitely better quality than the case example I just showed you. But when you look at them side by side next to enhanced images with AIR Recon DL, you can really see a significant improvement. I think it's very obvious the reduction in noise, so the improvement in signal to noise ratio, as well as the reduction in the ringing artifact that we tend to see. And for those of you who are looking very closely, you can also see improvement, marked sharpness in some of the tissues of the skull base and head and neck, which we'll get into a little bit later in this talk. So when we first rolled this out, one of the primary questions that many of our colleagues had, both within our section and clinically, was whether or not lesion conspicuity would be maintained. And I can report back to you that sure enough, lesion conspicuity is maintained. Here are two examples, both original unenhanced image and then the enhanced AIR Recon DL image in this patient with a longitudinal cord signal abnormality. Here are some axial images where you see that the lesion itself is still visible. This is another example case here with sort of multifocal lesions on an axial image, and that lesion conspicuity is maintained. So we sought to evaluate this in a sort of more rigorous fashion, let's say, and we performed a multirater evaluation at UCSF with several of our neuroimagers. And this data we presented at RSNA 2019. But in short, we showed our raters both unenhanced and enhanced images and asked them to rate these images based on their multiple different domains, which you can see here at the bottom. And signal to noise ratio was significantly improved, as was anatomic structure, conspicuity, diagnostic certainty, and overall image quality. I'll note that we didn't see an improvement in image artifact, but this was broadly defined as a whole host of different artifacts and not necessarily focusing on the Gibbs ringing artifact. And to touch on the issue of lesion conspicuity, we did a non-inferiority analysis and found that lesion conspicuity actually trended toward improvement with AIR Recon DL over the original, certainly non-inferior, if not showing improvement across the board. One of the interesting findings we had, sort of touching back to that initial slide where I had highlighted the skull base and cerebellum, was the enhanced sharpness of some of the small anatomy in that we often evaluate as neuroimagers. And here I show you another example of the highlight, to highlight the sharpness around the nerve roots in the cervical spine, which you can see to much better effect after AIR Recon DL. So let's jump into discussing how we can improve image quality in small anatomy, skull base, and head and neck. And again, we'll come back to this theme of clinical scenarios. One such clinical scenario that we're often faced with is we're asked by surgeons whether or not there's involvement of the cavernous sinus in pituitary lesions. That comes up. And then we're definitely asked by both surgeons and neurologists to evaluate for mesial temporal sclerosis. So to look at these small structures that we sometimes have difficulty seeing unless we have a truly optimal exam. So here's two examples among many others where technology like AIR Recon DL can be really helpful to making diagnosis easier for us as neuroradiologists and making things a little bit more clearer. So we'll start with this example of the hippocampus. On screen left, you see the original acquisition, and on screen right, you see the acquisition after AIR Recon DL. And you can see the detail in the hippocampus, the small structures within the hippocampus that we use to assess whether or not there's any mesial temporal sclerosis or other alterations is much seen to much better effect here too following the AIR Recon DL. I'll show you another example. These are inverted T2 images, and you can see on these zoomed up images the sharper detail that's provided by AIR Recon DL. Certainly a boon for us when we're reading these studies. This is yet another example of the hippocampus. An enhanced image on screen left, enhanced image on the right, and you can see the sharpness of these internal structures of the hippocampus improved on the AIR Recon DL images. Here, yet another example. This is not hippocampus, obviously, but highlighting the improvement of these small anatomy, the improvement in sharpness of the small anatomy here up near the vertex of the brain, where we see sharper delineation both between brain CSF interface around some of the structures within the subarachnoid space, as well as within the brain itself, here between the gray and white matter, for example. And keep in mind, I'll use this time to pause for 1 second and sort of remind everyone of what was discussed earlier, which is there is very much a tunable factor for signal to noise ratio improvement. And as you deploy this tool in the clinic, it's maybe something where you dial in to a particular preference for your group. So if the initial enhancement or change in image quality is perhaps a little bit too much or something that you're unaccustomed to, you can dial that in and slowly build it in as you gain more experience with this tool. Some more examples of looking at some small structures. Here we see some tumor features that are seen after AIR Recon DL enhancement. So for comparison, a standard 3D image versus a 2D high resolution image, you can see internal anatomy of this lesion much better, with much better detail following AIR Recon DL. And how does it do in sort of more routine clinical cases? I'm going to show you a series of brain tumor cases. These are axial T2 weighted images, and a couple of questions for me. This happens to be an area of research focus for me, so I want to make sure that I can clearly see margins of lesions, and sure enough, that happens to be the case. On the example on the left, you can see that the infiltrative tumor margins are maintained. On the example on the right, you can see we can still see this ependymal nodule, some areas of expansile cortical signal abnormality, as well as a cystic change with layering fluid levels. And here are some zoomed in images highlighting those improvements as well. Some more images. Again, these are more real world images, right? Some maybe not as perfect as some of the examples that I've shown earlier, but clearly showing the enhancement in image quality after AIR Recon DL. I'll call your attention to the case on screen right, where you see cyst wall enhancement conspicuity that's increased. This margin here between the lesion and the adjacent ventricle improved following AIR Recon DL. And lastly, within this sort of set of examples, identifying texture differences can be very helpful for making the distinction, say, between true vasogenic edema and infiltrative edema. So that's something that we want to make sure that we're maintaining as we apply this tool. And sure enough, as you can see on screen, right, we still see that heterogeneity within this area of edema that I'm highlighting here with my mouse. And back to our example of the sella, I'm just showing a couple of further examples here of how we can improve conspicuity of small anatomical structures in the brain or skull base. Here you can see much more sharply defined tumor margins following AIR Recon DL. Another example highlighting the improvement in anatomic detail within the cavernous sinus and within the sella. If you look at screen far right and compare it to the far left image, you can see a marked improvement following enhancement with AIR Recon DL. Yet another example of image enhancement within the sella, and another one here. I particularly happen to like this example because it shows, again, how much sharper detail you get within the cavernous sinus. This is a post-op case, and I feel I can delineate the edges of the surgical margin and post-surgical changes much more readily following AIR Recon DL than I can on the standard images. Another example here where you see sharper edges of the tissues with large contrast differences. And I'll pause here just to quickly say, this is an area where, you know, having good partnership with our GE collaborators and providing feedback about image quality, about image appearance, of diagnostic utility is really what's going to drive further refinements in this tool. So as you start to adopt the use of this tool, I would encourage you all to maintain that open line of communication and collaboration, because it really will drive this further. And this was just something interesting that we noticed where the sharpness seemed to improve or increase or be greater rather in areas where there's large differences in contrast. A couple of final examples here of where there's image enhancement at the skull base. This is an orbits exam, and you can see how much sharper the detail is within the intraorbital contents. This is a real sort of another real world example of where this tool can provide additional utility is imaging of the extracranial vessels. So we're not infrequently asked now to evaluate for giant cell arteritis, and often images are come back as having relatively low signal to noise, and AIR Recon DL can bring that up and enhance that and give greater diagnostic confidence, we found. So how can we sort of put this together and use this tool to speed imaging up and actually add another sort of facet of value to the MR examination? So I'll close with this final clinical scenario. It's a patient who is in a motor vehicle collision. As you can see, there's a fracture of C2. And the question next is, we should get an MRI to evaluate the soft tissues for any injury. And this is the MRI you get back. Low signal to noise and motion degraded. And unfortunately, we're often in a position where a key management question isn't answered. So I think this is a tool where we can use the shortened scan time to reduce motion and therefore improve diagnostic confidence. And I'll show you what I mean by that. So here's an example. In screen left, these are labeled here: T2 flex, T2 stir in the middle, and stir enhanced with AIR Recon DL. And you can see the time savings that exist after you use a faster exam, or a faster sequence, pulse sequence rather, that you can then enhance the image quality. So T2 stir, inherently a little bit lower signal to noise, bring that image quality up to one where I would say is equivalent to our standard T2 flex potentially. You can also do that by changing things like number of averages. So this is, these are lumbar spine images, a T2 fat sat image, 5 minutes, 30 seconds of scan time here. 2 necks, you can see some motion artifact. You can cut that necks in half, cut your scan time in half, reduce that, the likelihood of that motion artifact, and then enhance the image, and you end up with something that I would say is significantly better than the original exam at a fraction of the original scan time. Again, another example, you can certainly use AIR Recon DL to enhance the existing scan that you've acquired, as we've shown throughout pretty much the entirety of this presentation, but you can also use it to bring up the image quality in a sped up sequence, such as this one here on far right, which is an axial T2 run at 1 neck, so half of what these first 2 images are. And you can see that the image quality mirrors, if not is greater than the actual standard acquisition here on far left. So there's, as I was mentioning, broad utility here. There's utility in diagnosis, right? Scanning the unstable patient, reducing that scan time, reducing the artifacts from motion that occur by being able to bring up image quality. There's a utility for operations in improving throughput on your scanners. There's a big potential benefit for moving research forward. And what I mean by that is you can increase time for investigational sequences. That's something we're really excited about, is being able to apply this tool to cut some sequences down while maintaining diagnostic quality, and therefore allowing more time for investigational sequences within the allotted scan time slot. And to sort of tie it into current events, there's definitely a safety perspective here, where you can use this to speed up your imaging and decrease exposure in the current pandemic setting. So to summarize some of the key points, we went over improving image quality in the spine, improving image quality in small anatomy, skull base, head and neck, and how we can use this tool to speed up imaging while maintaining that image quality. As I noted, this is one of many tools. I think one that we can stack with several other potential tools that GE has on its scanners to really improve patient image quality. And I want to highlight again that close collaboration really does drive continuous improvement of these tools, and therefore, again, better for all. And I think we can emphasize again the unique role of a tool like this in the current pandemic setting and beyond. And with that, I want to thank you for your attention. Again, thanks to Suchi and Rob, and my email is here. If you have any questions, please don't hesitate to reach out.